Hello class, my name is ADP, and this is my video presentation for electronic health record systems, its adoption and implementation in developing countries. For this slideshow, I'll be talking about the following: EHR background, what is EHR, how did it evolve, and how can it be used? The research questions regarding EHR implementation in developing countries. The EHR findings about its adoption and implementation in low resource settings. The EHR implications of research, strategies and planning of EHR adoption in third world nations. Last but not least is the summary, my lessons learned, and overall course takings. An electronic health record, or EHR, is software that's used to securely document, store, retrieve, share, and analyze information about individual patient care. EHRs are hosted in computers either locally, in the practice office, or remotely. Remote EHR systems are described as cloud-based or internet-based. Although EHR implementation has evolved for the last 25 years, much is still to be done to advance this technology in low to middle income countries to keep up with today's standard of medical information knowledge. The country's perspective on their public health policies and laws affect the future implementation of EHR access in both private and public sectors. These has evolved from paper charting back in 1990s, and it's translated to be further gone into electronic communication and documentation around healthcare facilities nationwide. This slideshow aims to address the following three research questions in regards to EHR implementation in developing countries. First is, what is the current state of electronic health records adoption in developing countries? The second is, what factors influence or limit the implementation and adoption of EHR systems in developing countries? The third one is, what are some strategies that can improve the implementation and adoption of EHR systems in developing countries? The specific questions chosen will be explained further in this video to provide extensive background on how third world developing countries cope up with today's technology and current public health demand. This will also emphasize how low to middle income countries can use EHR in low resource settings to contain any medical event or emergency in their area of regional responsibility. There are multiple findings of EHR implementation and adoption in low to middle income countries. It describes how third world nations can modify, redesign, and adjust their national health record systems in areas of interest to accommodate the need for EHR systems in the affected region. Electronic health record system usage in low-income countries is very limited because of the lack of infrastructure and support that is needed to maintain an appropriate response to a sudden medical outbreak. There is a way for EHR to be utilized in developing countries with poor infrastructure settings for healthcare technology to thrive. Electronic health in general can be equipped using low resource settings by implementing free open source solutions for EHR systems that will significantly improve the developing nation's healthcare with no financial support or minimal resources. The current state of electronic health records adoption in developing countries are still lacking, as evidence shows that their present situation in public health is not strong, with limited capacity to detect early diagnosis and medical outbreaks, causing an untimely collection of health information data that results to preventable deaths throughout the nation. Most of the current EMR and EHR adoption implementation in poor countries right now are limited to tuberculosis and HIV sectors in small, concentrated parts of the region. Studies have also shown that a developing country's functionality in the healthcare system and technical infrastructure is the main reason why EHR implementation is not readily available, and lack of resources is not an excuse, since international donors and sponsorships played a role to fulfill this need most of the time. EHR adoption in third world nations has been bottlenecked also by foreign policies and mandates that it prevent from advancing in their public healthcare system, where the government-driven approach is opposite to current EHR implementations in place to its origin countries. International organizations have been aware of this need to state EHR adoption in developing countries, such as United Nations and World Health Organization, but much work is needed to be done to implement these in action due to geopolitical and financial constraints. There are no sufficient studies conducted to research and analyze the need for developing countries to facilitate EHR in low resource settings. Foreign stakeholders and investors rely on medical data to provide scientific adequate funding in low to middle income countries. Some of the significant barriers that can prevent AHR adoption are limited computer literacy, access to technology, power interruptions, limited access to the internet, lack of EMR training, medical staffing's willingness to learn, and the lack of support for the healthcare system training. Financial constraints and lack of resources provide difficulty to acquire EHR systems to be established in poor countries, but with the availability of offline EHR systems from open source softwares, this will address the problem to adapt and innovate in developing countries worldwide. EHR systems will not be stopped from being introduced, implemented, and adopted in developing countries because foreign help is always available and paves the way to innovate and improve their patient care by incorporating EHR in their healthcare providing process. Open source systems has made it possible for EHR to be adopted in challenging areas and situations, although there is still more to learn from extensive research and future usability studies done in healthcare facilities in third world countries to fully comprehend and improve EHR adoption and implementation in the future. After researching about EHR implementation in developing countries, I have learned that technology advancement in healthcare information paved the way for electronic health records to be implemented in low-resource settings, specifically for developing countries. I have also learned that healthcare informatics is very extensive and leads to multiple branches of concentration. I have learned more in HIT by taking courses such as consumer health informatics, health information in older adults, and health informatics in general. It also plays a vital role in patient care, and it is essential to be standardized across multiple platforms to improve healthcare as a whole. This course will significantly help my career in the future as I'm planning to be in the health informatics field. And that concludes my video presentation about EHR implementation in developing countries. Thank you for your attention and have a great day.